beneficial to the juniors how to achieve success. It is going to be a fireside talk and mostly general and not related to science. A special program has been arranged so that juniors would be benefited.
Panelists.
Yeah. Yeah. May I request the chairpersons to honor the panelists, please? Chairpersons, మీరు ఇచ్చేయండి సార్. చెప్తాను. May I now request Dr. Meghna sir to honor the chairpersons. Now, for this interesting fireside talk, Unlocking the Secrets of Success, we'll have 3 stalwarts on the stage, and one will be unlocking the secrets of 2 more stalwarts, and one a national award winner, the other a winner of our hearts, Dr. Mohan Kameshwaran Padmasri and Dr. D.S. Deendayal sir. And their secrets will be unlocked by Dr. N. Venkatram Reddy sir. May I now request Dr. Singari Prabhakar and Dr. D. Satyanarayana sir to come on to the stage and be chairpersons. Kindly come, sir.
What is that?
But given the temperature outside today, it must be fridge side talk rather than fireside talk. Okay.
It's not there. Not necessary. Laptop. Connect the laptop. Dear friends, good evening to everyone and all. Many thanks to all the seniors who are sitting over here, the juniors here. This particular topic is actually a thought by myself in the capacity of organizing secretary and shared with my chairman and took the permission of him that I am going to talk on something which is not a science. and interview two legends and two most successful persons. For that matter, success is a reasonable word. For all that matter, who are sitting here in front, all seniors, they may be all successful in their life. In fact, I am also successful in my own way, in my own society, in my own circle, in my own patient circle. So, success is something which is a relative word. I think everybody will agree with that. And here, I have chosen two most successful persons in life. Let us learn something. And this talk of next 45 minutes to 1 hour is not about any science, not technology, no surgery, not academics at all. It is an interview with the two legends who are most successful in their life. They are mentors for many, many people, namely Dr. D.S. Deendayal and Dr. Mohan Kameshwaran, Padmasri Mohan Kameshwaran, for their way of dealing with the things and how they can get on certain things which in a difficult situations, and let us see how they came up in their life and throw some light on junior colleagues to have a idea about how we can take the things in life as they come in their way. And to introduce, it is like a fun-filled, rather fun-filled, if you take it that way, and it is on the lines of something, a chat with the, must have seen a coffee with Karan and something, things like that. And now, let me introduce Dr. Deendayal. Go into a little background. He is born in a middle-class family, whose father is an employee in the revenue department, whose mother is a school teacher, and worked very hard and came up and to establish himself as a good surgeon and good academician. And he is an excellent orator, a guest speaker for many conferences, and he himself conducted many, many workshops and conferences. And he is the first one to undertake and uptake radio frequency, and one of the first to take up the silo-endoscopy in the country, if I am not wrong. Then he is a good entrepreneur. That is where we have to learn something from him today. And he is into pharma business. He is into other businesses which I do not know much. Okay, if he reveals, okay, it is good. Otherwise, also we will just sense it. Then he is running two corporate hospitals of state of art, corporate hospitals successfully, and enormously established and built this empire where you are sitting, the Alankuta empire he has built with his own sheer sweat and blood. Then at 70 plus, he never neglected his patients. He is still working hard, getting up at 4 a.m. Let him reveal. I am not going to reveal that. Then come to Dr. Mohan Kameshwaran. I know something about him. I asked him to pass his biodata. He passed. He is kind enough to pass the biodata. He is a senior ENT person. He is a director of the MRF, the Madras ENT Research Foundation, which do a lot of charity work, and is a recipient of Padmasri Award in the year 2006, and is a recipient of BC Rai Award in the year 2008. There are few ENT surgeons who are Padmasri awardees in the country. It is a proud thing that a ENT fraternity should feel it. He is a pioneering cochlear implantation surgeon in entire India and also Southeast Asia and Asia. And it has a personal series of more than 4,000 cochlear implants. Let us give him a big hand. 4,000 cochlear implants is not a joke. He is the first surgeon to perform auditory stem implant in not only India but Southeast Asia. That's a very proud thing which one can feel. And he has a personal series of more than 50 auditory stem implants, which is one of the largest in the entire globe. 50 auditory stem implants. He has published more than 200 papers in the international journals and delivered 150 orations across the globe. He is a visiting professor for many, many universities, not only in Asia but also in Europe. And he mentored 45 centers for cochlear implantation in South Asia, India, and Africa. So let us welcome them with a big claps and go into the fun questionnaire that today we have with them. This is the thing. Sir, I have one person whom I know in and out, Dr. Deendayal, probably is born with a wooden spoon. And Dr. Mohan Kameshwaran, I feel, I may be wrong, a golden spoon. So, please answer a couple of minutes on this.
Thanks, Venkatram. First of all, before anything else, thank you very much for this wonderful opportunity. The whole title is very debatable. Saying unlocking the success, which assumes that you already are successful. Not necessarily. But whatever, I get into the spirit of the thing that you want to share your story with others. As far as my childhood, I was born to two very eminent parents. My father, Padmasri, Professor Kameshwaran, was a director of the Upgrade Institute of Otolaryngology in Madras Medical College. One of the pioneers in the field in otolaryngology, and he was one of the founding members of the Association of Otolaryngologists of India. He was a very strong personality, a disciplinarian. I had very little interaction with him, to be very honest with you, because he was a very, very busy academician and a practitioner. And, those days we hardly had spent time with our father. I very rarely had time to spend with him. In fact, even when I was in my 60s and he was in his 90s, I would not even sit in front of him. That's how it was. So that's how the distance was between us. My mother, late Professor Dr. Lalita Kameshwaran, again a very eminent pharmacologist, and she was the first lady dean of Madras Medical College, long history for nearly 180 years. She was also the first lady director of medical education in Tamil Nadu. And she was the founding vice chancellor of the first medical university, the Tamil Nadu Medical University. So she was a very eminent person. She was a vice president of the Medical Council of India. She was an extremely accomplished researcher. She was a PhD from London University, and she had more than 200 publications, more than 30 PhDs she had produced. So she was a very prolific researcher. Again, very busy. So practically, I was brought up by my grandmother, who was with me, and she was the one who gave me my childhood, happy memories, and also my values in life. But both my parents still mattered a lot to me. They molded me, shaped me. I was a very, I think, well-behaved child. I don't think I was a very naughty child or anything. I don't think I caused much problems for my parents. I always used to tell my parents later on in life that they were pretty lucky to have me and my sister, two well-behaved children. I was a very good student as well. I was a state ranker in my school final. I think I was state 7 or 6 or something like that. And I entered medicine entirely on my own. It was purely by merit. I never ever caused any difficulty for my parents for admission or anything. And I was a gold medalist in Madras Medical College in my undergraduate days. I had several gold medals, including surgery, medicine, even obstetrics, which I never liked. I got to university first. And many subjects, physiology, anatomy, many medals. So I went through with a very good academic record. And then I joined neurosurgery, so that's what my first choice. It was neurosurgery. I joined neurosurgery and I worked with a very eminent neurosurgeon, Professor Padma Bhushan, Professor B. Ramurthy. who was a doyen of neurosurgery in India. And I worked with him for a year. And it was an outstanding experience. By the end of the year, I was doing, I would open up the skull, craniotomies, I would open the dura, open up the tumor for him, and he would come and take over the tumor. And so my comfort level with the brain went up very well because of that exposure. But I didn't take up neurosurgery at the end of 1 year, even though he offered me a straight MS neurosurgery, a 5-year course. I didn't take it up because I couldn't stomach the mortality and morbidity. It is those days. I'm talking about before this, even CT scans. That's how it was. The only investigation we had was plain X-ray skull, tomography, and carotid angiogram.
That will come later, sir.
Yeah.
Pertaining to the question, I think I request both of you to be bit faster so that
Okay.
we have to
So
cover all the
I'll
questions.
just briefly finish it. So, it was too much to stomach. So finally, I thought ENT was a good field. And
That
that's
will
how we
come
did.
later, sir.
Yeah.
Yeah. Sir, quickly.
Quickly.
I've given your background, everything. Okay.
I'll make it as brief as possible. Economic background, I come from a middle class, mother teacher, father a revenue officer, most of the time posted in districts. Secondly, till my class 7, my mother took care of me. I lost my mother when I was in class 7. And my mother's sister, my aunt, took care of me with her family till I finished my MBBS. In terms of social background, because of the middle class background and childhood and upbringing, I'm talking way back 70 years, you can just imagine tiled houses together. So lots of boys running in the
Yes.
streets. You name the childhood game I have played.
That's fine.
I have played Gilli Dandlu,
Yes,
I
well-
played marbles, I played...
Wonderful.
all the things I have played.
Yes, sir.
Secondly, second important thing about my, social part of it is that I haven't been that good a studious guy. I was average. I was never great in terms
Fine.
of my studies.
Dr. Mohan, sir. Next question. Next question is on the screen, sir.
Passion to become a doctor, yes. I saw both my parents and
Passion to become ENT also?
Yes. I saw my father
Yeah.
doing work, so definitely.
Namely, you
yes.
are I label as a congenital ENT surgeon.
It's not congenital; it's acquired, entirely acquired. But
Deendayal may be acquired ENT surgeon.
acquired. I think acquired in spite of my father. I won't say it's because
The
of my
son
father.
following a father's specialty is very common.
No, let me tell you, Venkatram, it's not easy. It's very difficult. That's why I chose neurosurgery. But I came back to ENT because I liked it. And, I can understand the second generation ENT surgeons, like Palniappan is here, his son Sethu is now an ENT surgeon. Janakram's son is an ENT surgeon. Vijendra's son is an ENT surgeon. It's not easy for them. It's very, very difficult. Living up to your father's expectations. Shankar is the same thing. So for the children, it's very difficult to match up to the parents, especially when the parents are very successful.
Deendayal, sir,
So it's not easy.
have you had any passion to become a doctor in your school days?
How much time will you give me?
I
Accordingly, I'll answer.
need to cover all questionnaire.
No.
2
Depending
minutes.
on that, I'll answer.
2 minutes.
Because if I just start and you come in between, then I won't have finished with it.
3 minutes.
So give me time, I'll explain it.
Yes, sir.
Had any passion to become a doctor? Right from my class 7, I wanted to become a doctor.
Wonderful. ENT? Why ENT?
So this is what I said. I haven't finished that.
I
Then there
need
is no
to
fun in
I
it.
need to cover 15 questions.
I will. I'll give you time to cover, but let me answer.
No, it's all right, but there is a stipulated time. Okay, if the audience doesn't have any objection, absolutely I don't have any objection. Okay, go ahead, sir. Time is yours. Time is the sky. Sky is the limit.
I appreciate. Thank you.
No, I am a time-bound person.
Thank you,
I am
audience.
strict about timings. But if there is no time for the audience, absolutely fine.
I just wanted this little part, why I wanted to become a doctor when I was in my class 7. We were 3 children, me, my sister, brother, and my mother. We were in that house. She complained of chest pain. Nobody at home, middle of the night. I ran across half a kilometer to a family doctor asking for help. His wife refused that he'll come for a home visit. Then I had to run a kilometer, call for my aunt, then brought her, they put her in a rickshaw and took her to Gandhi Hospital in Secunderabad. She was admitted saying that they brought her late. And she lived for 2 days, and September 7th, 1966, she passed away. That was the time my mind started running, and I was thinking that, where did it go wrong? And that is when I decided, I think I have to become a. Until today, I never refuse an emergency. That is one thing. That is my passion. I never say no to a patient. ENT surgeon. I wanted to become a surgeon. And during our PG days, we had only 3 choices. Either you take medicine or surgery. In surgery, we are given 3 choices. So I first put as general surgery. The next thing I put as obstetric gynec because I was a gold medalist in obstetric gynec. And the third thing that I put, because I had no other choice between ophthal and ENT, I put a ENT surgery.
Yeah.
And I missed general surgery by 2 marks. And I got obstetric gynec as one of the top.
Yeah.
I ran for it, but my wife gave the exam along with me at the same time. She got obstetric gynec, and she told me, I'll kill you if you take it. I don't want any competition. You become anything, but you will not become an obstetrician and gynecologist. So I'm
That's
an
wonderful.
ENT surgeon because of my wife.
Wonderful. I think if you, the chairperson permit me.
Hey, thank you.
Yeah, absolutely
He's
fine.
allowed me.
Yeah, yeah. So I think in a nutshell, I think we got what we want. Then with the permission of the chairpersons, I just share my own for this question only in 30 seconds. Okay? I had a passion to become doctor because in village, I used to be taken to the adjoining small, it's called town. Whenever I had any fever, motion, or something like that, went to a doctor who is invariably RMP or some BAMS fellow. Lot of big line. So many people. One doctor will be seeing, other will be pushing. One doctor will be seeing, other will be pushing injections. Yes, so much big line. I want to become a doctor. In school days, ENT, I had no choice. Just like the Deendayal, I missed general surgery, I took ENT. I want to see the blood every day. That's it. Next. Mohan Kameshwaran sir, what is your daily typical schedule? This is personal. I am trespassing to your personal. So don't mistake me.
No, it's not personal. Nothing. There's no big secrets. Well, my day starts. I get up at 5 o'clock in the morning, and 5:45. I have a gym at home, so I go to my gym at 5:45. I have a trainer who comes exactly at 6:15. So 5:45 to 6:15, I'm doing cardio, either treadmill or EFX or cycling. 6:15 he comes, and then he puts me through 1 hour training of either upper body, lower body, weights. So it's by rotation. 7:15 to 7:30, I do stretching. So from 5:45 to 7:30, I'm in the gym in the morning. 7:30, I go, I have a quick shower and so on, a quick breakfast. 8 o'clock, go to the hospital. Surgery usually starts around 8:30. And I'm operating till afternoon, have a lunch. My wife joins me. We both have lunch together. And then I have a 1 hour break. I took rest. And by 4:30, I start my outpatients. Usually goes on till about 9:30, 10. And then I come home. From 10:30 to or 10:30, I mean, usually I had a shower and dinner. 10:30 to 11:30, I read. I'm very obsessive about it.
Nice.
And go to bed. So that's my day. That's Saturdays. I don't have a consultation, so I finish my work, surgery, and so on. Evenings usually I spend some time with my wife. Usually she has a hectic social program, so I usually tag along as a husband of so and so. And Sunday morning I spend in the hospital with my residents, with my colleagues. And afternoon I come home for lunch. Sunday afternoon is my free time.
Deendayal, sir. I think for the past 5, 6 months, I know his routine, he knows my routine.
I'll
sir.
start with my typical day. I get up 4 a.m. every day. All through, except on Sunday, I am forced to get up at 6 a.m. I'm forced. That's again my wife. The typical day begins at 4 and same thing, but I give 1 hour time to my spouse every day between 4 and 5 because both of us are professionals, both are doctors. That's the only time we get. We have a cup of coffee. Once upon a time, I used to make a coffee for her. Now we have a maid who makes the coffee. 5 to 6 is my exercise time. I have a gym, I work out, I do yoga. 6 to 7 is I do a lot of meditation. Meditation. 7, my day begins. And 7 o'clock, the day begins and my day ends at evening 7. I don't take an afternoon. I only have a lunch break. 7, I'm back home and I sleep early. I sleep by 9:30. That's my typical day.
Wonderful.
Professional life. 5 days a week, I'm a ENT surgeon. 2 days a week, I don't work. 1 day I dedicate to my 7 companies which I have, and I take care of all of them that 1 day. Sunday, I never work. I've given it up completely, and Sunday is absolutely family day. A family day, I spend a lot of time with the family. And of course, we have a lot of friends. We entertain them at that time, and that's the way my life.
Thank you, sir. Dr. Mohan, sir. First, you. See, both on the dais, they are great teachers and great speakers. I listen to both of them many a time. And looks as if the sugarcane juice is flowing from their mouth. Such a sweet orators, both of them. Sir, Mohan, sir.
This is pretty easy actually because I studied in Madras Medical College, and my teachers were all doyens. Every one of them was a renowned person, was a who's who, considered as almost a demigod in the specialty, whatever branch, anatomy, physiology, pharmacology, pathology, take it. And every one of them was a great teacher. And I think that automatically came to all of us. So we just imbibed their skills. As a mentor, I had 2 mentors whom I can think of. Both were non-ENT. One was Professor B. Ramurthy, I said, neurosurgeon. Other was my general surgery professor, Professor Rangabhashyam, again a Padma Bhushan.
Other than ENT.
Other than ENT. In fact, these are the 2 people who shaped me as a surgeon. So I think that is my real mentorship. Of course, in ENT, I've had a whole lot of people.
What is your message to the upcoming teachers?
Well, it's simple. I think the art of teaching is just to share your heart. That's all that you need to do. You have to just share your heart. Students can always sense where it's coming from. So you just have to be honest about what you have said, what you have done, and that goes across.
Deendayal, sir. Sir, lovely teacher. Passionate.
Where did you learn? See, when I think back in my school days, there was one teacher, I'd love attending his classes. 7th, 8th, and 9th class. Because we were all backbenchers, and this teacher used to make things simple, explaining it, like making it so simple that we used to find it interesting. I give him a lot of credit. His name is, we used to call him Joy Sir, Joy. And in real sense, I did not have a mentor, but what I realized was in MBBS, my juniors used to ask me to teach them. So in fourth year, I taught third years. In final years, I taught fourth years. As a house surgeon, I was teaching final year students. And they would enjoy because with only one aim, how these people will pass their exams in the first attempt. That was the aim of teaching. And coming to the message to the young upcoming teachers, I will say teaching is a passion. You should be passionate about teaching. And here I would definitely use a little bit about definitions in nothing but Sanskrit. You know, the word called adhyapak means a person who shares or gives information. And a person by name Upadhyaya means a person who imparts knowledge along with information. The third person is called as Acharya. Acharya is the one who teaches you skills. And the fourth person is called Pandit. Pandit means a person who is super specialized in only one specific thing. And last one, they call it as Guru. Guru is the one who gives you the wisdom and takes you out of from darkness
Ill things.
to light. So, for a teacher, do you really want to be an adhyapak only giving information? Or do you want to go through this whole thing to take your students? Is the question that they need to think.
Wonderful. Mohan sir, I think you are fond of going very much. So, is the right person to answer this. Going abroad, settle there, no, come back. Every person should do it.
Oh, everyone should travel, there's no doubt about it. And you should go to as many centers as possible, especially in your very young formative days. When we were very young, we didn't have much opportunities in India. We had to go abroad to get our training. So immediately after my MS in Padmasri College, I immediately left. I was in UK. I got trained in UK. I did my fellowship. And I was there. In
I
some
think
of the
there are
best
some very good advanced centers
but
in India.
today, the situation is different. That's what I'm going to say. Today's situation is very different. You don't have to go very far. You still have to go to other centers in India, centers of excellence, where you know that people are doing fantastic work. Go and see that. This will give you an idea. It will broaden your horizon. So I don't think See, the problem is, if you just allow me 1 minute, the problem is only in India we have a 3-year postgraduate training program. Every other country is 5 years or 6 years. Even in Sri Lanka, even in Bangladesh now, they are making it 5 to 6 years. So in 3 years, you're not ready to face the real world. So you need to go spend another 2-3 years visiting good centers, seeing people doing good work, learning from them, and this gives you further skills to pick up. Go abroad also to centers of excellence, visit them. If not for anything else, two things you'll get. One, you will know why they are, doing good
Yes.
work, what makes them click.
Wonderful.
Secondly, it will build you contacts, which is international. You will start making friends across the globe, and these stand you in good stead. I have friends from UK, from US, from, various countries in the world, almost every country in the world, for the last 30 years, 40 years. And that stands you in very good stead, as you get older. When you get older, you realize that the only thing which matters is your friends. That's all matters.
Deendayal sir, your message on this question.
It depends on your financial status.
Yes.
It depends upon at that moment.
Everyone cannot afford.
Your personal and your family commitments. But there's definitely one take-home message. I definitely agree with Mohan about this, that the minute you pass out, go to some good centers in India first, which doesn't cost you much. Once upon a time, during our time, it was not that easy to get the centers. Now, you really have some people who are doing some excellent work, and they will entertain you. And once you get used to that, put in about 5 years, then you would have known which subspecialty you are more inclined into in ENT.
Wonderful.
Then go abroad, get trained, come back.
Yes. Dr. Mohan, sir.
I think it's an individual choice. It depends on what you want. But if you're going to go into private practice, as Sam said, take your time.
It is all the preference and choice of the individual.
Take your time, get your skills done before you enter into private practice, because private practice is so encompassing. It takes away your time and energy quite a bit. Teaching profession, if you're interested in teaching, yes, please. It's a wonderful thing. It helps you to keep up your, update your own knowledge. Only as a teacher you update your own knowledge and your skills. So it's something which is definitely worth considering if you have interest in teaching. And government job, I never worked in the government, so I'm not.
We were all from government jobs.
So I cannot I'm not qualified to talk about it. But I would find it very difficult personally. My personality is such that if there's somebody telling me not to do this or that, I would, if tempted to do exactly the opposite of whatever they're telling me. So I don't think I'm suited for government job. Really.
Yeah, that's one. Sir, your take on this.
I'll start with teaching profession. I've already made a statement. You need to have the passion. Second important thing, apart from teaching profession, having a passion, no two students are the same. No two students are the same. And one of the most important things I have already mentioned, do you want to be an adhyapak or do you want to be a guru? Or do you want to be an acharya? You decide what you want to be. And in teaching profession, there is a catch point that you need to understand. It is karmic. Because of you, the society is going to change completely, the field of ENT. Because of you, hundreds of students are going to do wonderfully well. So I'll say, be good, do good, feel good. That is as far as teaching
Wonderful.
is concerned.
Great message.
Now coming to government job. Government job is an addiction. It is what I call it as a false sense of security because you get your pension. It's a false sense of security. And government job is one thing where you take many things for granted. Here I would say those people who take up government jobs, be truthful. That means what you have to do as a doctor, do that 100% in that government. Don't take it for
True,
granted.
but government may not permit. It depends on which state, which conditions you have, and which environment you are living in government. Because bulk of the patients are treated in the government hospitals, and bulk of the students, they come from government hospitals. Government hospitals are ill-equipped, and most of them are ill-equipped, and only few of them are well-equipped. Anyway,
See, again, coming to private practice, one
Yes.
statement I haven't made.
yes,
Private practice can be you having a clinic, your own hospital, you're working for a corporate hospital. So it depends many ways in terms of private practice.
you are free.
So you need to know your aptitude, where you would like to be a part. But here again, I will use the word, be truthful to yourself. Like means, go to a corporate setup and corporate has got certain rules and you have to break your, what you call it as your rules, regulations. Don't do that.
Sir, this has become very, very common nowadays. Mohan, sir? It is so common that last month when I was just, I have a couple, the IT professionals, both are IT professionals. I was examining I was just simultaneously talking and examining. The wife was the patient, and the husband was Googling, all the time Googling. So when I am telling some diagnosis, he's Googling. When I am writing investigation, he's Googling. So how to carry on? What is your personal?
Simple. I don't allow anybody to have the phone active when they come to my room. They switch off the phone. So I never have anybody with the phone in front of me. Second thing, this is an endemic disease now. It's called Googlosis. So it's a very common problem. And I think we have to face it, But the point is, if you are knowledgeable and you give them the truth, no Google is going to refute you. So that's not a problem. So I think, you have a patient who comes with a certain problem. You tell them exactly what they have, what they need, and then after that, it is their headache. The way I see it, it's my job to empower a patient with knowledge, information, but then they have a choice whether they want to follow your advice or not. It's a free country, they have the choice. So let's not get too upset if they choose elsewhere or choose a different thing. I don't believe that I have to treat
So
everybody.
they already come with some knowledge.
That's fine.
Opinions.
That's better actually. Somebody comes with knowledge. See, I get patients sent from all over the country. Most of them are very knowledgeable because they've already seen about 4 or 5 ENT surgeons who give an
I
opinion.
think there are some doctors who say at the end of the consultation, you go on Google and get information and come back to me for surgery.
No, I don't say that. I tell them this is it. This is your problem. This is the solution that I would offer. And then I give them time. I said, you go think about it. And if you really want me to do it, come and see me and then I'll sort it out.
Deendayal sir.
There are two parts.
One, first part.
Google patient,
Yes.
Google Pati patients. I love Google Pati patients. I love them because they are educated. First, they are educated. They are not come into a category of non-educated. They have gone, researched everything, and their mind is fixed. You must understand these are the patients who will understand logic if you are truthful. They understand logic. The problem here is many a time we are so busy in our practice, somebody comes and tells us about our specialty or what we need to do, we tend to get a little irritated and we don't like them. We need to understand that it's their life. We need to understand that they want to find out the best. So we have to slightly modulate ourselves, but logicize with them. They will be good. Coming to second opinion part of it, patients come to you for second opinion for 3 things. Where they want a diagnosis, they've already gone somewhere, or 2, somebody else has advised a surgery and they want to come and take yours. 3, already operated somewhere else, want to come for a reoperation. This second opinion is difficult. This second opinion cases, you need to give a lot of importance to history, investigations, sometimes our other associated specialty opinions before you come to your final diagnosis, because that's a second opinion for which they are coming, and whatever opinion you're going to give should be the final opinion. They shouldn't go to a third person. That's the way you need to look at.
Yeah. And regarding second opinions, third opinions, fourth opinions, they come with all files, previous files. Do you really see the files?
Yes, not I, but I have doctors who see, they make a synopsis, they put it in front of me. I have had patients who have gone to 21 people,
Fine.
21 doctors.
Sir, Mohan Kameshwaran sir.
Fortunately, not many patients are angry. Most of them are very nice and quite happy. But if there is somebody who says, it's usually a question of misunderstanding, lack of communication. I think the way to get out of that is to communicate to them clearly about the problems, about the challenges, why something can go wrong. And if they understand and that they know that you are well-meaning and you're trying to help them, then I think even the most angry patient will eventually settle down.
Sir.
I'll elaborate a little.
Sure. Because audience are in favor.
Thank you. Anger is an emotion. Anger is an emotion. It's a negative emotion. And intelligence and emotion don't go together. An angry patient you try to rationalize will never listen to you, will never ever listen to you. So don't try to be intelligent. There's only 2 words an angry patient will understand. I understand or I'm sorry. These are the only 2 words they'll understand, angry patients.
Right. Well taken.
And second, why does a patient get angry? Waiting time is one thing, money is another thing where something is said and something is given, wrong diagnosis. The fourth one, investigation report wrong, surgery has not got on well, complications. Deal with them. Deal with them, empathize with the patient, then you will see. And sometimes use a relative of a patient who is not angry with you to communicate. That's how you deal with angry patients.
Wonderful, sir. Mohan, sir.
I've never faced a situation, but I've seen some very good friends face a situation.
This is becoming very common in
Yes, it
different
is.
parts of India.
Unfortunately, it is.
And I also saw in Europe also it's happening,
Yeah.
and several.
So I think most states now have enough legal protection for doctors. But even so, if you face an angry mob, get help. Get help. So I think you need definitely can't handle it alone. First thing to do is to get help, preferably from the police or somebody who's there in your neighborhood, and deal
Sir,
with them.
police are always in favor of patients.
Not necessarily, Venkatram. There are many of them. If you are a doctor, you have treated many
Unless
police and
the
so on.
police station house officer
Yeah, well, your
is very close to you.
Local police would have taken help from you. Most doctors would have some link with them. So get them to help you, but never face alone. Have a
So
group
one
of
practical question: if unexpectedly due to anesthesia problem or surgical issue, the patient, you have seen the elective case, the patient has died on the table. So how a juniors can handle the situation?
I can tell you, it's not easy. It's very very difficult
Not easy,
situation,
yes.
and we are not.
That's what I wanted to.
Yeah, we are not trained to do that. And if you just give me a minute, my first experience was in England. I went and joined within a month. I was a registrar, and there was a death of a table of a 22-year-old boy with, malignant hyperthermia. And there was no one. I was a senior most as a registrar. Senior registrar, the boss, nobody was around. I had to go and bring the news.
All
And it
the
was-
seniors sitting over here all experienced this.
this is a very difficult situation, but you have to use, like he said, empathy. That's the most important thing. And they realize that you are sympathetic towards them. And then you communicate clearly and honestly about what the problem was. Never hide facts. Tell them the honest truth, that this is the reason why situation happened like this. And what could have been done to help them, and now how are you going to help the family cope with that? That's all you can do.
Deendayal sir.
Here, extreme anger makes you violent. Extreme of anger. And a group of people who are extremely angry become a violent mob. Can anger and you trying to explain go together? No way. Any amount, whatever could be the cause of death, which you would have even told in advance, they would have signed a thing over there, high risk case, but still that is something that you need to keep in mind. You cannot sit down and discuss with them, they will not be able to understand. You need to understand, because I know this particular part. Do you know that there is a thing called as a Medicare law, as far as Telangana is concerned, that has been introduced, that there is a 7-year rigorous imprisonment to the mob that has come in. And the Bharatiya Nyaya Samhiti has put in a 2-year rigorous imprisonment. I think it is
But
351 article.
implementation of the law abiding forces is not there.
This has to be put and displayed in your hospital, number one. Number two, most important thing, we also have a hotline now available wherein it's called Omnipolis. You just have to press a button. It is run by the retired police people. Within 5 minutes, the police will come. Within 5 minutes, you're supposed to pay an annual fee for them. Third important thing is you must have an advocate friend. Advocates are excellent in dealing and calming down the thing. And the fourth thing I would definitely like to mention over here,
these days,
the security staff which you have, 30% of them should be women. Because the violent mob will always push the women to the front.
So nowadays what's happening is if you have a big political boss, nothing will happen.
I'm talking what we can
What
do.
legally we can.
See, we can see what trying to say is what is in your capacity you do.
You do.
What has to happen will happen. That is as far as
Dr.
violent mob
Hitesh,
handling.
Dr. Hitesh want to comment. Hand mic, please. Hand mic, please.
Hello. What I am telling is, sir, if nothing works, just run away from the place. Save your life first. No, we fear running away also. The problem is doctors don't run away. And they feel that if they will run away, the mob will feel that you are wrong. But law will not look at it like that. Right? To save your life, jaan bachi to lakho paye. Always run away from the place and then the situations will be dealt with. So don't worry in
Sir,
running
only
away.
one point I wanted to add to that. At Jaipur, we have a SOS group on WhatsApp. So anything happens to any particular clinic or hospital, he will just press a button on SOS. He will message there, I'm in trouble, and his location. So that rings in our WhatsApp group, and people rush to his clinic from all around hospitals and clinics with their
nowadays,
staff.
yeah.
Their staff. So
Sir.
you develop a mob in front of
there is-
that mob,
no, there will
and
be-
that cools down the things.
No, there will be unending questions on this. No. See, there are some towns in my district.
1 minute.
All the doctors have got a connection to each other. And whenever any incident happens, in any untoward incident suddenly happens, almost 30 to 40 doctors will land there. So that kind of protection is essential. The first and foremost. Because nothing will stop. If the violent mob is there, your security doesn't work, your displays doesn't work, nothing works. That's my experience anyway. We'll move on to next question.
1 minute.
Yes.
During my experience, including IMA, the first answer you said that is 100% correct. What we are doing every day, almost once in a week, we are getting such incidents. As Mohan Kameshwaran sir said, no sympathy, no nothing works out there, sir.
Nothing works.
Nothing works out. We should not speak with them. We have to inform in advance. Patient is going to die to our
Yeah.
friend circle.
So-
That committee is there. That people
Anyway.
will come and they will secure us, and then immediately you inform the police. Under any circumstances, don't compromise with the patient attendance. Inform the police. Police will also try to negotiate.
I
with
think
us.
in this, the first is the police.
Give something and they will go.
The
on
first
like
is the police. Because if the mob of 100 people accumulate, the first police will come. Sir, you just go through this back door to my police station and sit there. And we'll sit there, we'll offer a cup of tea and coffee, write something and we can push off and then we can fight the legal battle later on.
What we are doing,
That's
sir,
what exactly happens. Okay.
What we are doing, we are doing under legal. Send the patient for the postmortem. Only thing is, they have to complete the case. Each line is sentenced. And politicians don't inform any politician until unless he is very close. That is the thing. And you should attach with.
Okay. No, there will be unending question. This is the last question because it gets prolonged. Quickly, hand mic. 1 minute, only 1 minute.
We come from districts where this kind of problems happen every other day. So I'm in the local IMA. So we've seen the first thing you have to do is call your best friends. Yes, sir. Call your best friends, and local IMA has to involve. President, secretary has to inform. Only then you announce the death of the patient or anything bad happened to the patient. Only break the news then, because the mob will come in. Otherwise, you don't do this.
Yes.
Thank you, sir.
Now, I'll move on to next question because that is a very, very controversial. Everybody tries to jump up and speak. Yeah. This is something we really need. Sir, I think you already partially explained. Balancing work and life.
Yeah, I think, basically, the most important thing is an understanding spouse. Now, being a spouse of a doctor is not easy, very difficult. I think, it's very challenging, but if they understand, then I think most of us can work out a balance between the three. I'm pretty sure.
I would say balance your professional, personal, family, social, and also your spiritual life. You balance all these five, you will definitely have a sense of happiness. And in that sense of happiness is, I will call it as a fertile ground for you to see success coming in all aspects. Because the main topic is on success. That was one thing I wanted to put in. And here I would say rule of 8 works beautifully. 7 to 8 hours of sleep, 8 to 9 hours of work, and balance 7 to 8 hours, whatever is there, you divide it between family, your personal, your spiritual life.
Mohan sir.
If we all compromise on sleep, I'm insisting, sleep is your best friend. That is what I'm trying to say.
Dr. Mohan sir, a minute.
Yeah, I'm very bad on social media, very, very bad. So I don't think
So, you never think it is useful?
I'm not on FB, I'm not on Instagram.
Deendayal, sir?
WhatsApp, I really don't look at it very much. I'm a member of, I think, 50 WhatsApp groups, but I don't look at any one of them. So basically, I'm not a very great social media person.
Social media is a very dangerous master, but a great slave. Remember, if you make social media your master, it will eat into your personal life, your sleep time, and your professional life completely. Use it as a slave. What I mean by use this social media as a slave is, see now everybody, 90% of people are on the social media. You want to give some educational inputs onto social media, that will definitely help. See, after all, you're doing some service to the society by putting certain posts on social media. 90% of people are on social media. And WhatsApp, for example, is a nice way of communicating with the patients in terms of certain information you want to pass on, you get the thing. So use it to your advantage, but don't become a slave to social media.
Sir, next.
Surgery, complications, how we explained pre-op. The example I give is a flight. When you go and sit on a flight, the air hostess comes and says, if there is a drop in oxygen, the mask will fall down, so you'll have to use a mask. If it lands on water, you will have this. So you'll have your jacket and you pull this and it will inflate. Water will, if you touch this, light will come up. It doesn't mean it's going to happen, But then, you're explaining everything because, this is the way you have to be informed. Same way as a surgeon, I explain my complications to them. I tell them these are all the possible complications which can happen. But basically these are all very, very rare. It doesn't happen. And I've not seen this in many, many years. So it's a safe procedure. Every action has a cost-benefit ratio. So think about the benefit, not only the cost. So you're going to do a procedure. What happens if you don't do it? And then what is the risk of it going wrong? It's very small. So it's acceptable. That's how I explain.
Yes.
I think style of explaining complications
Anything you differ from Dr. Mohan, sir? Anything you differ from Dr. Mohan Kameshwaran?
That's what. If I accept, I would have said, it depends on the patient. A patient who is educated, or it depends, there is one type of patient who will blindly have faith in you. Doctor, we trust you, you do what you want. Easy to explain. There's a second time who has a little apprehensions. You explain a little, they'll accept. The third one is the difficult one, which will keep on asking. These are the ones who got information from others, who has read. So these are the people you need to be careful and explaining complications. You have to give an
Google patient comes in this category.
Exactly.
So one, if I can just add one thing, that one of the very common questions that you face is, can you give guarantee? Guarantee. So I always tell them, the guarantee is given.
No guarantee, no warranty.
No, it's not that. Guarantee is given by the manufacturer, not by the service engineer. So I am the service engineer.
Sir, mechanical goods. Not human being is not a mechanical good. Yes. No, sir. This is something.
Well, all of them are important. See, if you're a good surgeon, you are known in your locality or your city or your town or your state. You're a very good surgeon. You're known in your country, as. But you really want to be known beyond your country, internationally. It's only a publications. Remember that. So, if you want to be known globally and respected globally, the only thing that does that is publications, writing, books, and so on. Surgery, good thing. You become known in your country, in your locality, you're famous, but you really want to go across the border, only publications.
Next question.
Can I explain? Presentation in big platforms. In fact, there is something I would definitely want you. Don't copy paste. Don't from the textbooks. It should be something like case series. I would say talk your walk. What you have walked is what you're going to talk. That is something that you definitely need to view in terms of big platforms. Let it be original. Publications, the good old word, publish or perish. That's the word. It is publish or perish, but here keep in line the word called plagiarism. There's going to be a lot in terms of plagiarism, and that you have to be extremely careful.
Yes.
Writing a book is an art.
Yes.
Writing a chapter is easy. So you must be artful to write a beautiful.
Mohan sir, any regrets?
No regrets at all. If I have to go back and do the same thing, I'll do the same thing. So I'm very happy with what
Sir.
I've done. And no sorrowful events. I'm a very happy man. Yeah.
Deendayal sir.
Past is past. So past is something you should get over and think of now. So there is no regrets in life.
Regrets
There's
should
no
be put
sorrowful
behind
moments.
immediately.
Past is past.
Yes. That's wonderful. Mohan sir.
The happiest moments in my life, there are many happy moments actually. But I think recently the happiest moments were birth of my grandchildren.
Sir, Deendayal sir.
I have a lot of happy moments. Quickly, I would like to share.
You can't name them. So
Happy
many.
moments. The day I got married to my wife, it's a love marriage. That was roughly in the year 1979. Simple registered marriage. Happy moment. Then the other happy moment was 1979. I used to do general practice. 1 rupee, 2 rupee notes with coins. One day, I got 100 rupees for consultation. I was so happy. 100 rupees. That was a very, very happy moment. 1981, the first two-wheeler I bought was a two-wheeler Lambretta second hand for 1,500 rupees.
Yeah.
I was the happiest guy on earth. That was my Lambretta.
Yes.
Then my 4 children, and now I have 6 grandchildren. I'm very happy. All these are my happy moments.
Thank you. Yeah, last and final question. 1 minute to each. Because I'm under pressure. The neck talks are there.
It's very simple. You dream big, work towards your dream, but be satisfied with what you have achieved in life.
In there, sir.
1 minute.
2 minutes. Because you are my chairman.
See, I was thinking about it. It's unlocking, what was the...
Secrets of success.
Secrets of success. I want to introduce 3 words. Attitude, gratitude, happiness. Attitude is the mental spectacles with which we look at life. Are your mental spectacles transparent, or are they colored, or are they opaque? If they are transparent, you are looking at life the right way. That means you're looking at half glass full. You're not looking at half glass empty. Gratitude is something wherein you'll only look at the positive side of life and never on the negative. So, having an attitude of gratitude, give you a state of happiness to see for something that is positive. And when you are, show me one unhappy person who's successful. Show me one happy person who's successful. Every successful person is happy. There is nothing like unhappiness and success. So, you need to have an attitude of gratitude to be successful and to be happy. And happiness is the soil on which success comes.
Wonderful.
And 90% of the people will have all the things going right in your life. Only 10%, 90% of times all the things go right in your life. Only 10% of times it doesn't go right at all time. Correcting that gives you success.
Absolutely wonderful. And thank you very much for the very smooth answering by the two legends here. And I also thank all the senior colleagues who are sitting in front rows. They are all no less than the legends who are sitting over the dais. Thank you very much for attending this particular session, and thank you.
Venkatram, Reddy.
One question.
One word.
With the permission
Madam.
of chair.
Yeah, one word. Really excellent program you have organized, Dr. Venkatram Reddy. Sir, I think with your cooperation, he might have organized this one. And only one word I want to say these two great people is, they don't have ego, ego, ego. You can talk with them anytime. You make a phone call also, they will lift. That is, if they are busy in the private practice or with the patient, after some time they will call you back. Or if they are walking anywhere, if you see them, they smile at you and they are down to earth. That is their greatness.
Thank you. Sir. Why can't we give a standing ovation to the dons? All the people, please, please, please. Thank you, thank you, thank you, sir.
Thank you very much. I think I was a little apprehensive whether I could insert this particular program any opposition. There is no opposition. Entire thing is a supposition. I am very grateful to all the audience over here. I think all senior Medicare is there, Dr. Krishna Reddy is there, PSN Murthy, so many senior. They are all successful persons, but I cannot take everybody onto the dais. So it's only I can choose my own personal choice. Thank you very much.
Venkatram Reddy.
Please allow the one question.
Sir, these speech by speakers, sirs, social, physiological, philosophical, spiritual aspect of the ENT, sir. Thank you.
Thank you very much, sir. We would now request the chairpersons, Dr. Satyanarayana and Dr. S. Prabhakar, to present the mementos to the participants, Dr. D.S. Deendayal and Dr. Padmasri Mohan Kameshwaran, sir. I would now request the chairpersons to present a memento to Dr. N. Venkatram Reddy, sir. I would now request Dr. Anand D. to felicitate the chairpersons. Thank you very much. We will now begin with the next session. I would request Dr.